Hi, welcome to Snackable Health. I'm Mike Gibson. I'm joined by Kohli. Now, today or this weekend, we saw guidance from the emergency medical systems in California saying that if you are asymptomatic and test positive, you can continue to work as a healthcare provider. If you're exposed and you're asymptomatic, you continue to work. What are some of your reactions?
Honestly, Mike, I am stunned. I could not believe that this came out and is based in science because number one, EMS in particular go from home to home to home. And we know that after 5 days, there is going to be a proportion of people that are still infectious. We also know that if you're testing positive and just because you're asymptomatic with this particular virus, it does not necessarily mean that you're giving off a very low viral load and you're not infectious to others. So I've just been amazed that this kind of guidance has come through. For me here in Colorado, I'm looking at it as sort of a warning sign of what's looming on the horizon. And I can only imagine that the reason that they came up with something like this was to really stabilize the infrastructure of the emergency medical personnel in a crisis mode. But this is not where the rest of the states want to go. What do you think, Mike?
Well, most virologists are saying that the asymptomatic people are a big pool of people that are, giving the virus to other people. So just because you're asymptomatic does not mean you can't transmit this disease. Also in the news today, the UK adjusting their guidance from 10 days of quarantine down to 7, but not 5. Their modeling suggested that at 5 days, 31% of people will still have live virus that can infect others. At 7 days, that drops to 15%. It's not until you hit 14 days, it's 1%. So a lot of ongoing controversy here. Thanks for joining us, Paul.